I will now take leaders' questions under Standing Order 27. I call Deputy Colm Keaveney.
Thank you, Laskin Corla. Tánaiste, I cast your mind back to November 2012 when the people of this country went to a referendum to amend the Constitution to provide for children's rights. You remember some of the rhetoric. Government spin at the time was to ensure that children were to be front and centre of all public policy in this country. And unfortunately, Tánaiste, the actions of your government in the meantime in this area can be said to be slack. You've cut guidance counsellors in this country, cut child benefit, you've cut core welfare payments to under 25s in this country. Tánaiste, would you acknowledge the publication today of a report into mental health services in this country? And in that, would you acknowledge some of the startling details with respect to the welfare of children who this morning are waiting for over a year to access mental health services in this country? As we speak here this morning, Tánaiste, 3,000 children are waiting to access, 3,000 vulnerable children are waiting to access services. 400 of those children have been waiting over a year. Tánaiste, the report is quite startling in that it confirms what we've been saying to you for quite some time, in that community mental health services for children in this country has been shattered by this government, and in fact, only 42% of the complement of staff that are required to protect the most vulnerable people in our society were only in situ last year, Tánaiste. Tánaiste, the report confirms something quite startling, and it's something that we have raised with you before. Tánaiste, 1/3 of vulnerable children in this country who access mental health services are being admitted onto adult wards. Tánaiste, would you give me a date here this morning when you plan to seize the Dickensian action of putting children onto adult wards? And Tánaiste, would you give me confirmation, Tánaiste, will you give me confirmation this morning that best practice is provided for in those adult wards where children have been admitted? And Tánaiste, will you give me assurances to the Dáil this morning with respect to child welfare practices on adult wards where your policy is providing for 1/3 of all admissions of children are being admitted onto adult wards? So, to boil this down, 2 questions, Laskin Corla. When will the government give us a date that the practice will cease for admitting children into adult wards? And are you satisfied that the best practice on child welfare guidelines are in place? Before you give me the answer, I have a PQ on that. And I want you to publicly assure the people of this country this morning that children being admitted to adult wards have the comfort of the best practice and guidelines for their welfare.
Thank you.
Thank you.
Tánaiste.
Thank you, and thank you for raising the question. In fact, I think when you're on this side of the House, Deputy, you often praise the government for the priority it had given to children in the context of the very difficult situation that was inherited, and I can remember you on many occasions actually commenting how Fianna Fáil, your current party, had cruelly reduced the supports to families in relation to areas like child benefit, and you were very eloquent on that. And just to remind you, in relation to your comment on child benefit, just to remind you, in relation to your comment on child benefit, that I was very happy to increase child benefit by €5 a month in this year's budget. Not as much as we would like, but we've promised to do the same again next year. Just in the context of your opening comments, Deputy. Secondly, of course, all mental health services are incredibly important, both to adults and specifically to children. And I think it's been recognised and agreed by all parties in the House that the practice of children ending up in services intended for adults is not appropriate, and that the development of child and adolescent mental health services is an absolute priority and has been for my colleague, the Minister of State, Kathleen Lynch, and indeed for the Minister for Health, Minister Varadkar. So just again to put it in context, notwithstanding the severe financial difficulties that the country found itself in at the time of the last election and from 2008. An additional 125 million and some 1,150 posts have been provided for mental health since 2012. And you'll also be aware that there has been a fairly ambitious programme of investment in capital resources and improvements, the actual opening of new mental health facilities, the opening at a local level right around the country, which people can see at the moment, of large numbers of primary healthcare services. And central to the provision of the primary healthcare centres has been the actual provision at a local level of mental health services, including mental health services for children and adolescents. And that, of course, is the setting in which we would like to see children and adolescents who experience mental health difficulties receiving the care, the counselling and the other services which their conditions may require. In fact, seeing children hospitalised would be, I think, for most professionals in the field, the last resort and only in cases where it is possibly the only way of helping a child or an adolescent in very severe difficulties.
Deputy Colm Keaveney, supplementary question.
Tánaiste, as a father of 3 children, I think you've become a cold-hearted technocrat. Your response has been appalling here this morning. I simply asked you, when will your government cease the practice of admitting vulnerable children onto adult wards? You'd be very aware last week of high-profile incidents of inappropriate relationships between staff and service users. I'm asking you to give a date, nothing else, not waffle. Let's pull the curtain back here and look at actually what's happening on the ground. Please give me, the country, the date in which you intend to stop the practice of admitting children onto adult wards. And can you guarantee these people up here today that the practice, best practice prevails with respect to child welfare on adult wards? Are you satisfied that child protection officers exist across adult wards where you admit vulnerable children? Nothing else. Just deal with the 2 questions. Don't go on a meandering road somewhere else about some time in the past. You're in government for 5 years. Deal with it. You're here for the last 20 years, and listen, part of the furniture. Just deal with the questions. Vulnerable children. You botched up the referendum. Now is an opportunity. Now is an opportunity to deal with the substantive question here this morning.
Thank you.
A date. When will you cease the admission of vulnerable children onto adult wards? And can you guarantee here this morning the welfare of those children with respect to child protection? That's the key question. Nothing else. No other recall, just those 2 questions.
Thank you, Deputy. Tánaiste.
Well, first of all, I'm not quite sure why you're referring to a botched referendum in relation to children. Sorry.
You're not a Supreme Court.
I think I hear the undertones of another conversation that perhaps Fianna Fáil and others are having. But that's a different issue. Just let me say that the children's referendum was passed in an open vote by the citizens of this country. You may have a different view of it, but you should actually respect the will of the citizens of the country when they voted. So don't be describing it the way you're describing it. The second point is, as I said to you, and by the way, we're 4 years in government, you know, and that's a 20% differential, by the way, on the reality of what you suggested. And I do recognise that you are the father of 3 children and that you are interested in this area, as you said. So let me just take what you've said seriously. We have invested right across the board as a government in children and in children's needs, and let me be very clear about that. And to reiterate, and the committee and the groups of people who have come together in relation to child and adolescent mental welfare issues have acknowledged on a number of occasions and in commentary the progress that has been made. Yes, the progress that has been made. Well, you need to read that actually, as just opposed. In fact, it actually recognises in that report, if that's what you want to talk about, the progress that has been made by this government in relation to children. It actually acknowledges and recognises it, because I sat down and read the report. You possibly only read the cover. So what I want to say here is that as a government, we are going to continue, as resources permit, to expand our investment in relation to child and adolescents who have mental health difficulties, and in particular to actually make the rollout of the primary care centres, which are now right around the country, the primary location for dealing with children who have problems in relation to mental health, as close to home as possible and with as little inpatient treatment as is only strictly necessary. Because the best way of treating the child is to treat the child, and on many occasions as well, to assist the family, the child's family, to cope and to deal with the issues that the child is facing.
Thank you, Tánaiste.
So at the moment, we have, as I said, we have begun and we are investing in an enormous range of additional facilities which are broadening, as we speak, the availability of the resources to children. And that has been acknowledged, Deputy, if you want to be honest in this discussion, by the people who are actually, and the organisation, acknowledged by the people and the organisations who are working in the field.
Thank you, Tánaiste.